Welcome back. It's time now to answer some of your most popular and common medical questions. Joining me with all the answers is News Channel 5's medical specialist, Dr. David Soria. He is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for coming in.
You're welcome. Glad to be here.
We've got some good questions today, questions I think will affect a lot of folks. The first one is sort of an anger management type of question. This viewer writes, is there any truth to the saying that anger hurts your heart?
Yeah. This question was really upsetting. Believe it or not, usually it's obviously a figure of speech.
Right.
However, it is tied to heart disease. Matter of fact, there was actually a recent study that showed that hotheads, frequent hotheads, not just somebody that just gets angry every once in a while, but frequent hotheads had an increase in heart disease of almost 20%.
Wow.
So why is that? Well, clearly when you get angry, your cortisol levels go up, your adrenaline, your blood pressure goes up, your heart rate goes up, and that has a long-term damage on the heart vessels, which can then lead to heart disease.
Interesting.
Now, above and beyond that, if you already have heart disease, meaning coronary plaques, you're diabetic, you have progressed disease, if you get angry, you can actually have a heart attack because your heart is going to need more oxygen, and thus it's not going to be able to get it, so you can actually have it.
Wow.
I can't tell you how many times I've seen that where somebody comes in after a fight with chest pain, and lo and behold, they're actually having a heart attack.
Wow.
So chill out. It's a risk factor that can be controlled, thus control it. Anger management, relax, don't get that upset. It's not worth it.
So when somebody says calm down, I mean, really?
It's that simple.
Calm your body down, too. All right. Our next question is this. Oftentimes, I wake up with pain in my feet, and as the day goes on, the pain goes away. Is this a serious problem?
Like most non-specific symptoms anywhere in the body, there's always something that can be serious. A lot of different things that's non-serious that can cause foot pain. Corns, bunions, tendinitis, fasciitis, even a pinched nerve in your back can cause isolated foot pain. But the differentiator here is that it goes away or it changes throughout the day. Now, one thing I do want to mention that will change throughout the day that is serious is peripheral arterial disease. That's where you have clots in the arteries and your leg or your foot isn't getting enough blood flow and thus oxygen. That can be painful. However, typically that gets worse with exertion. Okay? So the key differentiator here is that it gets better during the day. The one thing that gets better throughout the day that's painful in the morning is rheumatoid arthritis. So if it classically will get better throughout the day, but you can be fooled because sometimes you get up, you walk around, claudication, which is not enough oxygen in the foot, can be painful. You go to work, you sit at your desk, and it feels like it's going away. Can be serious. Don't guess. Make sure you get it checked out. Come see us or call your doctor.
We're nearly out of time, but I did want to get this last question in quickly here. I seem to be having more stomach aches lately, and I have not changed my eating habits.
When I hear stomach pain, I feel, or I tend to think above the belly button. You got the liver and the gallbladder, you have your stomach, and you have your pancreas. We look for certain symptoms that can cause that based on where, when they occur. Does it get better? Does it get worse with food? The one thing I want to mention, though, is that when you have stomach pain and you have risk factors for heart disease, you're a smoker, diabetic, over 40, it can many times be the lower part of your heart trying to have a heart attack. Don't blow that off. Make sure you come see us. Or ask me a question on WPTV.com, and I will get back to you on that.
All right. Thank you so much. As always, great advice each and every Wednesday with Dr. David Soria. We will see you next week, and we will see you right after the break. Stay with us.